difficult to believe, but you're looking at a mountain of smoke. Yes, industry has housekeeping problems too. Smoke, the product of industry, was collected in special smokestacks, compressed into pellets like these, and piled here. Until 8 years ago, when this pile was started, all of this smoke was in the air that people were breathing. Now, by the simple throwing of a switch, an electrostatic precipitator goes to work to remove this public enemy so that it may be added to the harmless mountain of smoke. Industry didn't build this equipment sooner because it didn't know how. In fact, it took over 10 years to develop and to build this plant near Duquesne in Pittsburgh, which just does one job. It removes ferromanganese dust. And every day it builds this mountain of smoke even higher. In just 8 years, built up pellet by pellet, this mountain has grown until today it covers 5 acres of ground and is 100 feet high. All over the country, in fact, all over the world, polluted air is a problem. More and more people are aware of it. More and more people are talking about it. Some people are doing things about it. Among them are Dr. Leroy E. Burney, Surgeon General of the Public Health Service, U.S. Department of Health, Education, and Welfare.
Air pollution is a public health problem nationwide in scope. It is not limited to any one cause or any single community.
And his colleague, Dr. Richard Prindle, who heads the air pollution medical program of the Public Health Service.
How does polluted air affect your health? We already have some of these answers.
And Vernon McKenzie, who is in charge of the engineering side of the servicemen's service air pollution program.
How does the air get polluted, and what can we do about it? We have some answers to these questions, too.
Yes, the federal government is working on the problem, but basically it is a local job. One of the pioneers in cleaning up the once smoky city of Pittsburgh is Dr. Edward Weidlein, retired president of the Mellon Institute of the University of Pittsburgh.
I first began to urge that Pittsburgh's air be cleaned up 45 years ago, after World War II. It became a tremendous teamwork operation, with labor, civic organizations, and city and county governments all working together to clean up Pittsburgh's air.
Another pollution fighter is S. Smith Griswold, Air Pollution Control Officer of Los Angeles County.
The name of our public enemy in Los Angeles is smog. Although Los Angeles is a relative newcomer to the air pollution problem, we have a very serious one and are working hard to solve it.
This is Public Enemy, the story of man suffering from the byproduct of his own progress, the story of air pollution. This isn't a problem just for the experts. Everybody causes it. Everybody can help to whip it. Backyard incinerators and open rubbish burning. Factory emissions. Automobile exhausts. Refinery, chemicals and fumes. Burning leaves. And open burning dumps. Those sources cause things like this to happen in a community. The problem of clean air is a major one in many parts of the country. With the growth of our cities and the parallel growth of industry has come a brand new kind of life, a standard of living higher than the past could even have dreamed of. But where you have progress, you have problems. Air pollution affects almost everyone and everything in 8 principal ways. Health effects, irritation, nuisance, soiling, corrosion, reduced visibility, damage to plants, and damage to animals. The air over our cities can probably never be returned to the purity of the wide open spaces. To breathe this kind of air, we must travel ever-increasing distances. But we can make it fit to breathe and keep it that way. Pittsburgh, St. Louis, and others have pointed the way that they are winning the first half of this air pollution battle, the fight against smoke. One of the reasons we've made this much progress is because years ago, a few men recognized the dangers of air pollution and decided to do something about it. Dr. Weidlein, I understand you began fighting air pollution back in 1913.
That's right. Pittsburgh was indeed a smoky city in those days, and it took a long, hard fight to change it. Many men had to change shirts twice a day. It was dark in the middle of the afternoon. Every building in town was ugly with grime. Our problems in Pittsburgh was a result of the fact that it's a heavily industrialized area, coupled with the fact that the fuel used for heating was soft coal.
Well, how did Pittsburgh get cleaned up?
By everybody working together. Everybody helped. Some people used to think that you had to have smoking factory stacks to have full paychecks, but they learned otherwise and joined the fight. Others said that cleanup campaigns might raise prices, but they learned that it cost more to be dirty than to be clean. Service clubs, church groups, industry, labor, unions, everybody pitched in.
Would you say that the air pollution problem in Pittsburgh has now been solved?
No, it hasn't. You must understand that the contemporary air problems involves a great deal more than smoke. Chemical gases and even metals are discharged into the air. No city has yet succeeded in controlling those sources of pollution.
Well, I realize that. As I deal with the news daily, I continually run across items about air pollution in more and more cities. It's obviously a national problem. Dr. Burney, does the federal government have any regulatory power in air pollution?
No, Carl. As with many other public health problems, we believe that the basic responsibility for control and enforcement lies with state and local agencies. Our job is to contribute to research on problems that are national in scope, both in our own laboratories and through grants to other institutions, and to assist states and communities by providing technical assistance to them and by helping to train air pollution specialists.
Well, would you say, Dr. Burney, that air pollution is a major health hazard in America today?
Carl, we are trying to find out how serious a health hazard pollutions are in America today. We know that air pollution can cause death under special circumstances. In Great Britain, the medical profession agrees that air pollution is a basic cause of a condition called chronic bronchitis, which ranks third among causes of death in England. Fortunately, chronic bronchitis is not a major problem here, but there is statistical evidence which suggests that air pollution does have an effect on health.
You mean that breathing city air over a period of time may be harmful?
Yes, we know that there are toxic substances in the air which, in higher concentrations, can be harmful or fatal. We know that there are organic substances in the air which act as irritants to membranes and tissues. And we know that people in cities have a much higher death rate from a number of diseases than people living in the country. I'm going to ask Dr. Richard Prindle, who is in charge of our air pollution medical program, to tell you about that.
The difference between urban and non-urban death rates for lung cancer, cancer of the digestive system, and arteriosclerotic heart disease is pretty dramatic. For example, out of every 100,000 people living on farms and in small towns, fewer than 15 will die of cancers in their respiratory system, the lungs, the bronchus, the trachea. But in big cities, what happens? The death column rises. About twice as many will die of these diseases. We get the same kind of picture with cancer of the stomach and esophagus, and with heart disease.
And you blame air pollution for this?
Not exclusively, of course, but it seems like a likely suspect as a contributing factor, along with increased strains, accelerated tempo of life, and many other factors.
Well, I can see how the kind of air you breathe might affect your respiratory system, but why do you think it affects the digestive system and the heart?
We don't know exactly what happens to the pollutants when they get inside us, but we know that many air pollutants are swallowed. The possible relation to heart disease is more indirect, but it is possible that irritants in the air cause changes in the tissue of the respiratory tract. These changes hamper breathing, and this, in turn, affects the heart and circulatory system.
I gather that most of the medical research is an attempt to find out whether the pollutants which man puts into the air, some of which we cannot even see or smell, stay in our system, building up gradually or causing progressive damage, slowly undermining our health.
Exactly. We already know, of course, that intense pollution can and does kill. It has happened both in this country and in Europe. The onset of intense fog-holding pollutants which settle like a pall over the community, when this happens, people know it. Doctors work around the clock. Hospitals are filled. Deaths, particularly among the aged and the chronically ill, increase substantially. But more often, it happens without people even realizing it. For example, in London in 1952, there were between 4,000 and 5,000 more deaths in a single week than would normally occur. It was not until months later, when death records were analyzed in relation to weather, that Londoners became aware that the intense smog which had bothered them was actually a killer.
Well, then a killer smog could happen to any community at any time.
Yes, that is one of the reasons why people need to be aware of the dangers of intense pollution. If killer smogs are recognized early, sources of pollution can be temporarily reduced until the fog lifts. This way, lives will be saved.
Dr. Burney, is there any research underway to help us find better, quicker, and cheaper ways of cutting down air pollution?
Yes, Carl, actually a great deal, particularly in the engineering field. One of the big projects is the air sampling network, which has been built up in communities throughout the nation. Mr. McKenzie can tell you about that and about some of the other efforts that are being made to find out what's in the air, what happens to it, and how it can be better controlled.
You actually sample air, Mr. McKenzie?
Yes, we are sampling the air because before we can effectively keep pollutants out of the air, we have to find out precisely what's in the air. Consequently, sampling stations have been set up in all the states and territories, in about 112 urban and 49 non-urban sites. They are operated by volunteer agencies, usually local health departments, using equipment furnished by the Public Health Service. Dusts, dirt, and non-gaseous pollutants in the open air are collected at these stations and sent to our laboratories in Cincinnati. There, the sample is analyzed, and at 3-month intervals, the results of analyses are given to the sampling agencies. For sampling suspended solids, this apparatus, which is similar to the conventional household vacuum cleaner, sucks a measured volume of air through a filter. Over a 24-hour period, each of these samplers filter about 70,000 cubic feet of air through a sheet of paper made of glass fibers. Liquid droplets are filtered also and retained along with the solid particles.
Well, why don't the pollutants just blow away?
They do sometimes, Carl, but whether or not the pollutants blow away depends entirely on the wind and other movements of the air. Normally, on a nice clear day, the air near the ground is warmer than that higher up, and thus tends to rise and carry the pollutants up with it. Sometimes, however, the higher air is hotter than that at the ground because of a particular weather condition called an inversion. At such times, the air near the ground cannot rise, and the pollutants tend to accumulate just as though there were a lid over the entire area. Inversion situations may persist for several days, as occurred this fall in Los Angeles, causing several smog alerts. People often get the idea that an area must be surrounded by hills or mountains which form a kind of natural bowl for this inversion lid to cover. While a natural bowl formation helps keep the pollutants close to the ground, we don't need hills or valleys around a given area in order to have an inversion. An inversion can occur over a town situated on the plains.
Now that we're learning more and more about what causes pollution, communities are better able to deal with it. Let's find out what some of them are doing about it. Let's go first to Arnold Arch, a very important man in air pollution control work. He is president of the Air Pollution Control Association and director of the Air Pollution Control Division for Niagara Falls. What do you have to tell us, Arnold?
Hello, Carl. The city of Niagara Falls, New York, has long been known by the world as being famous for its cataracts and as a resort area for honeymooners. Niagara Falls is far more important as one of the most heavily concentrated and diversified industrial areas in the world. The fame of our industries is known the world over. It is not surprising that our air pollution problems caused the city of Niagara Falls to adopt the first all-inclusive air pollution control ordinance in New York State. Cooperation with industry is the basic theme of our program, and it has certainly paid off.
Thanks, Arnold. And now, to give us an insight of the air pollution situation in Detroit, let's switch to Morton Sterling, Air Pollution Control Officer for the Motor City.
Hello, Carl. This is Mort, Sterling, right in the middle of our new multi-million-dollar civic center. As you can guess, there's going to be a lot of white marble buildings located here, and we hope to keep them that way. Although you can't see it in the scene right now, Windsor, Canada is right across from us, across the Detroit River. The international aspects of our air pollution problem are obvious and I believe unique in this country. We hope to solve our transient ship smoke problem through the International Joint Commission this year.
And in Cincinnati, Charles Gruber is standing by to explain their particular situation.
Cincinnati has made excellent progress in dealing with sources of visible air pollution. Today we have 90% fewer smoking chimneys than 10 years ago. Cincinnati industries have also made good progress in combating fly ash, dusts, fumes, and odors. We must see that our community is informed and motivated to action as technical progress points the way to cleaner, healthier outdoor air.
Well, let's pick up another southern city again. This time we'll hear from Jacksonville, Florida, where H.D. Peters is the director of the Division of Sanitation, and T.B. Ard is assistant sanitary engineer. Come in, Jacksonville.
Yes, Carl, we in Jacksonville are conscious of our air pollution problems. And while not as acute as in more highly industrialized cities, they do require attention. Fortunately, we know our trouble spots, and with good cooperation are making progress towards control. Odors are more concerned than smoke and present more of a nuisance problem than anything else. Of course, as such, they should be kept to a minimum.
Now, let's sweep clear out to San Francisco, where Ben Linsky, Air Pollution Control Officer, will tell us about their novel arrangement, under which 6 counties and 70 communities are cooperating to combat air pollution.
We are standing here on Coit Tower on Telegraph Hill in San Francisco. I am Benjamin Linsky, Air Pollution Control Officer in the San Francisco Bay Area, where we have recently started our scientifically based air pollution reduction and control program. Because air pollution flows across political boundaries, we have merged 6 county lines and 70 city limits into a special government control district. No other large community anywhere in the world has ever yet has as clean an atmosphere as its people really want. We believe we can do it in this great Pacific Coast community by using the best engineering and community program methods developed in dozens of areas here and abroad during the past 80 years.
And now we'll hear from Dr. Leonard Greenberg, Air Pollution Control Commissioner of New York City.
Air pollution is a byproduct of civilization. Wherever large groups of people live and work together, air pollution results from their daily activity. Air pollution is produced by heating equipment in our homes and offices, by industry, by incinerators, and by automobiles. We in the United States have been slow to recognize the importance of this problem and to move against it. Therefore, air pollution has grown until vigorous action is essential to our health and well-being. We must reduce air pollution, and we must prevent the development of new sources of air pollution. Concerted and intelligent action now will be of benefit to all of us.
Probably the city I see most in the news is Los Angeles. How are you coming with the smog problem there, Mr. Griswold?
The problem in Los Angeles, Carl, is not one of black smoke, such as it is in many eastern cities, since coal is not used at all. We have a very complex problem of gaseous pollution, the characteristics of which cause eye irritation, damage to vegetation, and a bluish-gray pall, which, held close to the ground by the inversion, reduces visibility. The people of Los Angeles have taken drastic action to prohibit the use of incinerators or open burning. Industry has been controlled to a maximum that engineering science will permit. Though the required use of every known type of control device, many have been developed in Los Angeles area. In fact, industries which cannot control their pollution cannot now locate within the county of Los Angeles or its 62 cities. The major problem remaining is connected with the use of petroleum products in 2 different ways: by motor vehicles using gasoline and diesel oil, and by industry using fuel oil as a source of its power, when it is recognized that we have the highest concentration of automobiles per square mile in the world, as well as the nation's third largest industrial complex, then it must be understood that the combination of these and our surface inversions constitute a serious community problem. The Los Angeles County Air Pollution Control Board, headed by Supervisor Warren Dorn, has adopted a policy of requiring controls on every source of pollution when a reasonable method for such control exists. The board is holding public hearings on a rule requiring Los Angeles industry, including their steam power plants, to burn natural gas in preference to fuel oil during the 7 months during which smog is most likely to occur. The Air Pollution Control District is testing many devices for the control of pollution from motor vehicles. In its automotive combustion laboratory, when an effective device has been developed, its use will be required on the 3 million automobiles operating on our streets and highways.
Well, it's not only dirt that bothers Mrs. Public. In Los Angeles and many other cities, polluted air causes physical discomfort, too. And we have seen, Dr. Burney, some of the functions being performed by the engineering and medical divisions of the Public Health Service Air Pollution Program. Well, it seems to me that the problem is getting worse rather than better. As you pointed out, the more our society grows, the more air is being used and polluted, and the greater are the demands on the air around us.
Yes, and we have learned that air pollution and smog are not only unpleasant, but may have definite harmful effects on the health of the individual. There is much to be done about this growing problem, and much is being done. For example, in research. In addition to the extensive research program of the Public Health Service, a great amount of research and analysis is being conducted in research laboratories in community air pollution districts, in city, county, and state health departments, and by industry. As we indicated earlier, the epidemiologic work is a very important aspect of the work being done. This shows us the possible relationship between air pollution and such health problems as lung cancer, heart disease, and stomach cancer. Another very important activity, as described by Mr. McKenzie, is the air sampling being done in more than 150 localities around the country. This national sampling network provides the information communities need to attack the problem on the local level. Every day we are analyzing these pollutants in our laboratories, ascertaining their content, the extent of pollution in the various communities, types of sources, and other important data which is needed in combating this problem. But the job doesn't end with the medical, engineering, chemical, and sampling operations. Another important phase is the education of individuals concerned with the air pollution problem, and this includes a great many people. The United States Public Health Service conducts an active training program through which regular and frequent courses are provided to air pollution control people from all over the country. It is also important that people not primarily involved with air pollution control or research should know more about this subject. The better people in all walks of life understand this problem, the better we will all be able to deal with it. An active program of public information and public education is therefore essential. One method of informing the general public, for example, is through this program. The Westinghouse Broadcasting Company is performing a fine public service in producing this program as a means of helping inform the public of the various aspects involved in this very complicated and very important problem. The dissemination of both technical and general information is one of the reasons I called the National Conference on Air Pollution in Washington, D.C. More than 900 people, including leaders of civic, labor, industrial, and many other groups, in addition to air pollution specialists, took part in this conference in November 1958. Various research institutions and local control districts, including several we have heard from on this program, sent exhibits to this conference. A complete aerometric station with the most up-to-date equipment was set up and put into actual operation on the grounds of the Sheraton Park Hotel throughout the sessions. Samples of Washington air were taken on special filters, which were white when they went in, blackened by pollution when they came out. Conference delegates spent a day hearing reports from air pollution and industry authorities, technicians, and health officials. They devoted the second day to individual discussion groups, and on the third day heard reports of these discussion groups, followed by an open forum question and answer session. We hope this conference will be one more landmark in the long battle against air pollution. I hope it will be a turning point so that, say, 10 years from now, the people in every community will be breathing air that is cleaner and more wholesome. We can reach that goal if we all do our part.
Well, I certainly want to thank you, Dr. Burney, for taking your valuable time to come here today, and also for bringing Dr. Prindle and Mr. McKenzie along with you. We certainly appreciate your efforts. And, of course, our special thanks to Dr. Wideline for interrupting his retirement to bring the benefit of his many years of experience, and certainly to Mr. Griswold for coming to us from the West Coast and telling us of the problems of Los Angeles. Thank you. Public Enemy. The story of the byproduct of man's progress, air pollution. Was directed by Jerry Lee. And produced by Roger Wolf. Your host has been Carl Ide. This program was presented in the public interest by Westinghouse Broadcasting Company, in cooperation with the Public Health Service of the U.S. Department of Health, Education, and Welfare.